Today, I want to have a conversation that could change the way you think about healing and chronic pain. If you've ever felt frustrated by traditional massage therapy or have a condition like scoliosis that seems impossible to manage, this episode is for you. Welcome to Holistic Hope, the vegan friendly podcast show that uncovers the secrets to health that you've been searching for. I'm your host, Amanda Cuda. Welcome to the Holistic Hope podcast show. I'm excited to introduce Kyle Carper, a licensed massage therapist, neuromuscular therapist, certified personal trainer, and nationally certified massage and bodywork instructor, whose innovative approach has done wonders for me personally. Not only has Kyle helped me manage my scoliosis without the pain I usually feel after a massage, but I've even noticed my spine beginning to straighten. So exciting. Welcome to the show, Kyle.
Hello. It's great to be here.
Yes, Kyle, I've been seeing you as a client now for it's been just over a year or a year and a half.
Yes.
And I know when I was first introduced to you, I'm just going to get this straight out of the way. I was so skeptical.
That is not unusual.
It's not unusual. And what happened was, so Kyle works out of a med spa that's literally 10 minutes down the road from where I live. And the owner, I'm really good friends with. And so she knows a lot about my challenges that I've experienced. And she knows I have scoliosis. So she must have had a conversation with you one day. And then she came and had a conversation with me, trying to convince me that you're the man. And I was just like, no, 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 I don't like massage therapy. I feel worse afterwards. And so one day I was at the med spa having a different session with her, and she told me you were in that day. And so I waited around to talk to you, and we had an amazing conversation. I booked an appointment with you that day and been seeing you most weeks ever since.
Yeah.
So, Kyle, let's get into it. Tell us a bit about, I introduced that you do quite a lot. You have a lot of certifications under your belt. What made you get into massage therapy?
You know, I wanted to be a massage therapist since I was a teenager. I knew I wanted to do some sort of manual therapy. I've always had this fascination with the body, what we can get out of it, what we can put into it, how it's going to act, interact, react with what we do. It's always been that fascination, that drive of not only just what happens to it, but why. And I've always loved it. So yeah, when I was in my mid-teens, I thought, you know what, manual therapy is where I want to be. And it took a while to get there, but you stick with a goal and you get to it. So luckily I've been fortunate in where I've worked and whom I've worked with.
You have. And how long have you been doing this for now?
17 years.
17 years. And just like initially what you're saying is your fascination for how the body works, which, because I really wanted you to come on the show today because there is something different about you than everybody else I've met in this field. And I'm not an expert in this field, but you are different. And I think you just highlighted it there, your fascination, your drive to understand and learn how the body works. And you've also worked alongside in doctor offices as well.
Yes. One of the first, about a year after I graduated from massage school, I was fortunate enough to work with a company that sources out therapists to DOs, MDs, medical offices, medical centers to do pain management. So that's where I really kind of got into it. I mean, and to be honest, I'm not a spa therapist. I'm not that person. And there's nothing wrong with being a spa therapist because believe me, I know some phenomenal therapists that do that. That's their calling. I love that. Just that's not my mold. My mold is to look at an issue and want to fix it. So that's where I wound up. I was very fortunate to have that job. So for the better part of 6, 7 years, that's what I did.
Yeah. And I think that also sets you apart with that as well. So you worked with doctors like your DOs. I didn't know what a DO was until I moved to America. We surely have an international audience. Can you explain what a DO is?
Yeah. So here in America, we have MDs, which are medical doctors. We have DOs, which are doctors of osteopathy or osteopath. DOs tend to take a more integrative, more holistic approach to the body. They still practice allopathic medicine, but they have the philosophy that everything is related and everything
Yeah.
will affect everything else if we do something to it.
Yeah. And so you having that experience working in that field and talking with a doctor, getting to the root cause of a pain issue.
That's part of the fun.
And so I would say that you specialize in pain management
That's one of the things I do quite a bit of. Yes.
and definitely not a spa massage therapist because, again, when I first came to see you, even though we had this conversation, I was expecting the normal. I come in, take my top off like a spa massage. You take your top off, you have full access to my back. You're giving me this nice pampering massage. That was not the case with you at all. You're fully clothed and you are hitting spots that I say ow a lot. This is not really a great promo for you right now, but
Right.
it's really the truth, right? You have to say ow in order to know that you're doing the right work.
Often, yes. And when it comes down to it, it's not a matter of pain. Most of the clients that I see are already in pain. They're already experiencing pain. It's a part of their life. In some cases, it even defines what they do and who they are. We don't want to cause more pain. Intensity is good. A little discomfort is okay. But if we cause pain, the body's going to react. The body is going to pull away. The body's going to resist. We don't want that. We want to, when it comes to doing anything with the body, it's more of a cooperative effort. It's not a command, it's a suggestion. And so you typically a lighter touch, a lighter approach sometimes will do more than a heavier approach. There's always that, well, being a man, I can say this, when working with tools or anything like that, if it doesn't fit, get a bigger hammer. That does not work for this. Sometimes that lighter touch will yield better results.
Yeah. Yeah, and I'm not saying that it's excruciating when you're working on me.
No.
I do because of the scoliosis. I do find I am in a lot of pain and I'm just super sensitive.
Right. Exactly.
So, I'm sure you have a lot more resilient patience than me.
At the end of the day, pain is pain. When the body is protecting itself, it wants to signal you very quickly on that. So a lot of
Mm,
that pain, a lot of that feeling that you get is very surfacey. It's very sharp. It's got a little bit of sting to it. That's the body's way of protecting you. So when you're in pain like that, it's completely natural. So pain threshold is a very, very relative term. I will tell people
yeah,
that I will speak with patients often that will say, I have a very high pain tolerance. Yeah, they're right because they've been dealing with the same pain for months, years, sometimes decades. And hopefully
mm,
our job is to replace that pain with something that's more pleasant.
yeah. And even when you're hitting on a spot
Or
that I will say feels discomfort, sharp, uncomfortable, you're when you're working on me, you're not it's not I don't want people thinking it's like this deep tissue because I really hate
no,
deep tissue massage. It's not for me. But you will work on that spot, but then it will become like a dull sensation,
mhm,
is that the best way to
yeah,
describe it?
that's perfect. Yeah.
Yeah. And then afterwards, I feel great. Like a normal massage, the spa kind of type massages, I will come out of a session with the scoliosis feeling worse. And with you, I don't. With you, I come out and I feel great and I'm ready to tackle the day, get on with it, and just, I mean, sometimes I feel a bit zonked out just because I've been in a, slightly darker room with
Sure.
having body work done. So that
Right.
kind of zonks you out anyway. But generally, I feel better and, I don't have the pain. So I can continue on with my day and it helps me progress in so many ways.
Good. Yeah. Well, and that's part of what I tell people on a regular basis. I don't want you coming into this room and leaving feeling good. I'd prefer you come into this room and leave feeling better.
Mm,
And that's really the core of this work, is to have you feeling better and to be able to continue that feeling throughout your day, throughout your week, and really throughout your life. Hopefully
mhm,
we can get, if we do this work, we say faithful to the process. Often when it comes down to it, pain is, it's a response. If it's long term, it kind of becomes a habit, it kind of becomes a routine.
mm,
And to that point, we kind of change that habit. We don't necessarily make or break a habit. We just kind of replace it with something else. And so if we can give the body a healthier, less painful routine or less painful habit to go with, that's going to be the key. And that's the core of what we do, what I do.
mm.
So
And can we talk a bit more about the neuromuscular therapy?
yeah, neuromuscular therapy is exactly that. We're dealing with the nervous system, with the musculature of the body. When it comes down to it, that's the source of a lot of our pain. When the body experiences a trauma, the body wants to protect it. If it's an acute trauma, say to a joint or something like that, you'll notice that we get that swelling in the body. That's
Mm,
the body saying, okay, we want to immobilize this area. We want to bring fluid to the body. We want to bring blood flow, lymphatic flow to it. And that's great for a couple days. After that,
mhm,
then the body says, okay, this isn't working. We need to do something else. So it'll usually go into another step of tightening up muscle, of tightening up the tissues of the body, soft tissues of the body, again, to immobilize that area or to kind of shield it. Then after a while, that requires energy. So the body says, okay, we're going to do something that's more passive. And it will typically shorten up the fascial tissue, the connective tissue around it. And it'll adapt to what the body's doing. And
mhm.
that's where we get kind of this cycle of postural distortions, functional distortions, pain issues. The body does not look at it from a standpoint of, okay, we're out of pain, we can go away. It keeps that distortion because it's still looking at pain. It's still looking at the body as having that issue. So we can be finished with the initial trauma within a couple of weeks. We can have that pain for months and years. This has a reaction because the
Mm,
body's still saying, we have it. We want to take care of it.
right. And so then how do you go ahead and work with the body?
Yeah, with neuromuscular therapy, often it's about doing techniques that will reset the nervous system. They will break it
Mhm.
out of that habit. Knowing the nervous system, knowing what it will respond to is what allows us to sedate the nervous system on that.
Wow, that's really fascinating.
Yeah, it's great for parties.
Now, I just at the start of that, you said, like, when our body swells up, or when it's doing its job,
Yes.
getting the lymphatic system to the area, there is always this controversy with people for an initial injury using a hot or cold pack. I see you rolling your eye. I always wanna say, they always say, "Put an ice pack on it straight away," and I have an aversion to the cold. I cannot stand the cold. So you telling me that I'm in pain, and then you want me to put this, like, extremely cold thing on my skin? That's just making it a million times worse
Yeah.
for me. What's your opinion on that?
This is a debate. This could be a whole different podcast. There are different schools of thought on this. When it comes to ice for an initial injury, ice can help out. Ice can help to numb the area. Ice can help to dissipate swelling. Ice will also, even to some extent, bring on circulation, which we do want to help heal an area in the acute phase of an injury. After that, this is where things get kind of cloudy. One thing that we do see is that people will talk about for even chronic swelling, swelling that's gone on for weeks and months at a time. People will say, well, ice. Ice is great for that initial issue. Heat, actually, I've seen heat help do wonders for chronic swelling, for chronic inflammation. Um, Heat will bring inflammation to the area because it will promote blood flow. Now, to put an asterisk on all that, what I just said, swelling is not necessarily a bad thing. Yeah, as we've been saying right here, swelling and healing often go hand in hand. Now,
Yeah.
that's not to say somebody with chronic lymphedema is going to just do great with heat. They don't always. But for an injury, for a trauma, yeah, I am a fan. I'm in the heat corner. Let's say that.
Yeah.
So,
Yeah.
yeah,
It's nice to not have to go straight to the cold pack
right.
sometimes, and I don't know if I have it on my desk right now, I might not, but I have, like, a little rollable essential oil thing that actually has, like, the ice pack-ish properties to it. So it
Okay.
has, like, peppermint, so it becomes really cooling, and this oil, the properties and constituents act like an ice pack without me having to put something freezing on my foot.
Sure.
So I'll
Well,
actually put that on, and then I'll, probably go for a nice warm Epsom salt bath, get that magnesium into it without having to sit there and do your whatever it is, a couple of minutes on, a couple of minutes
sure.
off, and you're doing this back and forth with this ice pack thing. I'm like, "No, I'm just gonna put the oil on and go for a bath."
Right. Well, and I'll even say this too, for often when it comes down to it, if your body does not react well to one, then don't use it.
Yeah,
I'm not a huge fan of ice either. My body does react partially to cold. So
yeah,
yeah, to me personally, I do like heat, but I also know too that there are benefits to both.
yeah. Yeah, one of the things when I first started seeing you was because I was going to a chiropractor quite regularly as well. Because if I didn't, I would get really bad headaches. And which is really interesting since I started seeing you without the chiropractic, I don't get the headaches unless I've been traveling for a couple of weeks and then had been on those long 10 plus hour flights that throws the body out naturally. But one of the issues I was dealing with when I was seeing you was my thumb. I
Oh yeah.
couldn't straighten it. So I had this really awkward, I'd be on a Zoom call and people would be like, give a thumbs up. And I'd have this really crooked, awkward. And the chiropractor, he didn't know what to do. And so he was thinking that I should go talk to a surgeon because he thought I was at that stage. But after seeing you and probably, I want to say by within a couple of months, you had like me straightening my thumb. I just want people to know that I'm very much surgery should be the last resort that you're dying or something like really severe. I would never recommend surgery unless you need a heart surgery, something like super severe. Your gallbladder is erupted, something that's more life and death. But for my thumb, and I wouldn't be able to use my hand for a period of time, plus everything that goes with being under anesthetic, having all that stuff pumped into your body. So, do you want to talk through my thumb for people who are just like, oh, I've got this issue and I've been told I should have surgery? And what would you say to people who are in that space?
Yeah, when it comes down to the thumb is a perfect analogy for it. When it comes down to tissues of the body, whom you see will their approach is going to very much depend on what they do. What is their specialty? My specialty is soft tissue. When we assessed your thumb for the first time, it really felt like the range of motion was being limited by the soft tissues of the muscles. So that was my approach. I was just basically looking at the soft tissues and saying, okay, we can lengthen this. And the
Mm,
lengthening is a very simple approach. As a structural body worker, we do it all the time. We lengthen soft tissue and fascial tissue. And we know that depending on how we approach it with the strokes that we use, the pressure, the orientation, the direction of the strokes that we use, we can lengthen that tissue. We can bring it back into its proper form, proper function.
mhm.
So somebody else might look at that and say, well, let's adjust it or let's operate, whatever. It really does depend on the scope of practice and the approach that person has been trained in.
Yeah. Yeah. So if you don't like the treatment planned from a practitioner or somebody that you've seen, just know that they are people out there. You just got to look for them and find them and know that there are different ways to solve different issues, which is the whole idea and why I wanted to start this podcast. I don't believe that our body is deficient from a lack of pharmaceuticals. What's the root cause? And that's why I like working with you, Kyle, is because my recent vacation when I came back from Iceland and Canada, and on my last day in Canada, I'm walking down a trail. I twisted my ankle. I didn't really know what I did, but then I had a really sore foot. And then I came to you, and between you and actually the last episode was with our acupuncturist, and between the 2 of you, within a week, I'm fine. Where had I seen somebody else or not done anything about it or let it get worse or anything, that could have caused a bigger problem. But I just always have the people in my corner who know what they're doing to be able to help me move forward. I talk a lot about scoliosis because that's something I've dealt with since I was a teenager.
Sure.
And that's really has affected my whole life. And how you said it really defines people and who they are, what they're doing. And so being super skeptical me with wanting to see you. And I did actually have a chiropractor explain this to me one day why I do have such an aversion to massage. And that's because the muscles are, and you could probably explain this better than I can, but the muscles are being relaxed. And so what your body is always trying to do is always trying to get your head into the center, into a balance. And so when you relax the muscles, then after a massage, well, I've relaxed my muscles that are trying to bring my head into the center of my body. And so then they have to work extra hard after a massage to then get me back into my balance. And so the way you work with me, you're very strategic in which muscles you're working with to help me, get out of the pain. And so I want to share with people some before and after photos that we've taken with you working through with my scoliosis. So let me bring that photo up. So do you want to talk through a little bit of what you've done here? So because you can see where I'm got that curve there.
Okay. Like scoliosis, we're looking at imbalance. We're looking to find out where, as we call it in our body work, short tissue.
Mhm.
So we know that along the left side of the back right there, that arc along the spine is shorter on the left side than it is on the right. So we want to lengthen that tissue. We want to lengthen that tissue on the left. We also want to sedate the nervous system as well, because the nervous system is going to dictate what that musculature does from here out. A muscle does not fire at all. It doesn't activate at all unless the nervous system tells it to. So there's kind of the approach on this. We work with, again, if this is a long-term thing, which it is, not just the musculature, but also the fascial tissue will be affected. But the fascial tissue is going to shorten up on that left side. It's going to cause that lateral curvature. Lengthening that, getting the nervous system to sedate on that side is going to cause the muscles to relax and lengthen as well. That'll help to straighten out this. We won't fix the hard tissue. The bone is basically where it is. If it's malformed, it's adapted to years of that shape. That's not going anywhere for a while. But the musculature, the nervous system, the fascial tissue can all adapt to what we're doing. And that's where we get the straightening.
Yeah. And I've seen in my raindrop technique practice, we were at a wellness expo one day, and I had a girl come to our stand inquiring about raindrop, and she had the scoliosis surgery. And she was
And
still in a world of pain, even after having the surgery. And so, we were offering many treatments. My role on the stand that day was just to talk to people about it. And then we had other practitioners there. But I also had to send my practitioners for a lunch break. So I said to her, let me send one of mine off for a lunch break and I'll personally work on you. And when she came on the table, what that surgery had done to her back, it honestly, it kind of traumatized me. Like, it was very confronting for me to see that because that's where the surgeons wanted to go with me. They had me in a back brace when I was in grade 9 and grade 10, which I believe the scoliosis had already stunted my growth. And so that back brace really, and I don't know your opinion on back braces. Actually, we've never had that conversation, Kyle. But I never thought it was really going to do anything. But my parents were trying to avoid surgery, but it didn't work. And so then they said, we want to operate on you, but it's for cosmetic reasons. I was like, are you kidding me? A spinal surgery for cosmetic reasons? I don't have really I can't really say I have a huge issue with cosmetic surgery,
Sure.
but on your spine,
Right.
that's that's severe. If people can really understand your the function of the spine and to have surgery on that. So I worked on her and, to know she had the surgery, she was still in so much pain. I was actually shaken after that session. I went and phoned my mom crying and thanking her for, supporting me to not have the surgery. And I just want people who might be in this space where maybe they've had surgery, and I don't know if you've have any experience with working with people post surgery, but also just to people who are contemplating that maybe they're in a space right now where they might be getting surgery, and to say that, well, look at these results, and that's without
Sure.
surgery. And am I perfect? I mean, if you've got scoliosis, I don't think you can ever be perfect.
It'd be tough. It'd be tough.
Yeah.
Oh,
But to know that, look what I've achieved with you, and how that wasn't many sessions that we did this with. Do you remember off the top of your head?
it may have been, I know it's fewer than 10.
Yeah,
So yeah,
yeah,
6, 8, maybe. Yeah.
yeah, yeah, it was definitely I was seeing you regularly every week because, well, 1, and you weren't even just working on my spine at this point. This was the early
It's
days when
true.
you were working on my thumb.
Right.
So, my thumb was my biggest issue. Yes, I had scoliosis, but my thumb was my biggest
Right.
issue because it was affecting my work because 'cause I'm at a computer most of the time during the day. And so you were, like, working on my thumb with a bit of scoliosis stuff on the side.
Yep. That's right.
Yeah, people who are in that boat
Mhm.
of what is it with post-surgery, or what else did you wanna say about
You
this?
know, post surgery is a tricky one. When it
Mhm.
comes down to it, I have had patients and private clients who have come to me and they've said, look, I've had this surgery and, you can see where the rods have been inserted. You can see where the scarring is right along the spine and the pain doesn't necessarily go away. You're at this
Yeah.
point, when you are putting those supports in, you are basically immobilizing an area that should be mobile. We've got 26
Mm.
vertebrae in the body. They're made for movement. Anywhere where you got a lot of bones in the hand, in the foot, in the spine. These these articulations are made because we're supposed to move. We're supposed to be able to
Mhm.
adapt to our environment. As you said, keeping the head vertical, and straight. That's really what the spine does, what the body does. The body can be contorted as long as we have that straight, basically crosshairs type of position. So when it comes down
Mhm.
to it, oh, if you're putting rods on each side of the spinal column like that to immobilize, the body does not like it. The body wants to rebel.
Mm.
If you're doing a brace for that, the body doesn't like it. It wants to move.
Mm.
That's, we're human animals. That's what we're meant to do. And so when it comes down to it, if we're dealing with a pain issue from that post-surgery condition, we unfortunately we have to kind of work with what you got. But if we can get the nervous system again to sedate, if we can get the musculature to not activate so much, to not try to fight it, if we can again build a new habit around that condition, yeah, we're going to see a reduction in pain. I've
Mm.
had again patients and private clients that come to me just for after surgery.
Yeah.
So is it a perfect fix? No, but it is a help and it's a relief.
Yeah. One of the things that fascinated me when we did start working on the scoliosis was you didn't go straight to my back.
No,
You started with the psoas muscles.
Yeah.
Most people don't know what that is.
Yeah. The psoas muscle or the iliopsoas. Basically, that muscle is one of the most important muscles in the body. It gives us our
Mm,
posture. It gives us our initiation of movement. If we're walking, if we're running, if we're throwing, if we're doing something overhand, playing tennis, racquetball, pickleball, doesn't matter. A majority of your mobility and a majority of your strength comes from your hip flexors, which is the psoas. Psoas is your primary hip
mhm,
flexor. When we discuss doing core exercises, it doesn't get any more core than that. The position of the psoas makes it essential to work on for scoliosis and many types
mhm.
of back pain. It attaches to the spine. It attaches to the femur, to the thigh. And yeah, if it goes into dysfunction, it becomes short. And we have one on each side. So if it gets short on one side, everything's going to pull to one side. And
Mhm.
if it's not kept in check, then the body will say, okay, we're pulling to one side. Now we have to pull back over to the other side to compensate. Again, we're keeping we're keeping the head in that center position. And that's where we start getting that curvature. We start getting that lateral arc. That's what will work. That's the foundation of it. Nothing will get better until that is taken care of.
Yeah. Yeah, that really fascinated me because it really highlighted to me that you just weren't doing a surface level, let's just relieve a symptom, that you were, okay, this is the root. This is where we start with.
Absolutely. Absolutely. And that's always how it starts off, or it should. We discussed it before. As a therapist, my biggest challenge is not the body work itself. My biggest challenge is in the assessment. My biggest
Mm,
challenge is finding that primary imbalance, finding out where everything kind of stems from. Whether it's dealing with scoliosis, whether it's dealing with headaches, whether it's dealing with, any issues in the body literally from head to toe. It's all about the assessment. You cannot look at one condition and say, I got it. If you've seen one condition, you've seen exactly one condition. I'll say this as an industry, as a massage therapist. I feel that we have to do better, and even healthcare in general. We have to do better at assessing issues. We can't just give
yeah,
a cookie cutter approach on that. We have to go after,
yeah.
we have to find, in order to go after the main cause, we have to determine what the main cause is.
Yeah, and that's kind of what threw me off having chiropractic. Because I would go in and I would go with my husband, and the chiropractor would do the exact same thing that he would do on my husband that he would do on me. But we don't have the same bodies at all. And so for me, I know that I'm a very sensitive, special case, like everybody is, right? Everybody is
True,
unique and
true,
special in their own right.
exactly.
Or I don't really want to put down chiropractic because that's not true.
No.
I had a really amazing chiropractor in Australia, and he actually took x-rays.
Mhm.
And with every treatment, with every person, he'd bring up the x-rays and he'd be looking at, okay, this is the spots. And so I knew for a fact that he was working very specialized on each person.
Yes.
But when you go in there and you just feel like you're just another number, and again, there are different chiropractors out there are different massage therapists out there, and this is why I've got you specifically on here, Kyle, because I know you're not just, "I'm just gonna do this because 'cause I've been told to massage the body in this way." Like, you're after the assessment and how to treat people differently. Even to the point, and as this come back to the neuromuscular therapy, even to the point where at the end of the session, I really hated this, and Kyle knows I really hated this, that at the end of the session, you would have me do planks.
Yes.
Tell me what the purpose of the planks. Well, tell the audience. You've told me,
Oh,
not that I can, but
yeah.
tell people what the purpose of the planks
The
were.
$5 phrase, neuromuscular reeducation. Yeah. Basically, yeah. So basically what we've done is we've taken the body, we've reset the nervous system. We've sedated it. We've
Mhm.
got it to basically go to a baseline, just zero. Once we're there, now we're going to go one of two ways. It's either going to go back to where it was, or we want to take it to a different route. If we can get it to a different route, that means a difference. And a difference is what we need. So yeah, the planks were basically to get the body to start going in that new direction, to give the muscle and the nervous system a new routine. And if we can
Yeah.
make it into a habit on that routine, remember, a habit is something we do unconsciously. If we can get it to do that unconsciously, that's where the real change is.
Mhm.
So yeah, the
Yeah.
planks, I know you hated them. I know you didn't like them, but I swear it's like cough medicine. You don't like it, but it's good for you. So
Right. And that's just also a different unique point of perspective
yeah,
of working with you, was I'm not just going in there, laying down, having the spa treatment, thinking that everything's gonna be all roses and sunshine when I walk out. It was that you were doing root cause work on problems that I had been suffering with for over a decade, and not only was I just laying there and having you do the work on me, but then it came to where I had to match and I had to do the work as well.
exactly.
So a lot of people just there is no shortcuts in life to anything.
Yep.
Fixing up your health, you have to start with your food. Or you have to start with breaking habits. You're just talking about habits. You have to start with stop eating that high sugary ice cream 10, 11 o'clock late at night, or really any time of the day, really.
Yeah,
But you have to do the work. And so even coming to see you, I just don't want people to think, "Oh, Kyle's going to wave a magic wand and I'm gonna have this relaxed, pampering spa massage. He's gonna fix all my problems." No, he's probably gonna make you do planks or exercises, because you've made me do exercises as well,
mhm,
and I don't have it on my desk, it's actually in my bedroom, but you've given me this rubber ball. So if I'm
yes,
feeling like a different tightness spot in my back or even on my hand, you've given me this spiky rubber ball for me to do exercises with in between treatments, because you are actually dedicated in your patients getting better.
absolutely. My my patience getting better is what I do. That's a brand. That's my reputation, and
Mm.
that means everything in this field. So yeah, if I can give you something to do away from the treatment table that's going to help you, let's do it. Because number one, you are going to get better. Number two, I look good. No, but
Right.
no, but the bottom line, if you're getting better, people are going to ask you, Amanda, what
Mm.
have you done? What did you do? What was your
Yeah.
secret from a wellness standpoint? I think it's important for people to take ownership of their health. Okay. And you kind
Mhm.
of touched on it before. If you're not getting something that is benefiting you from one practitioner, don't give up. Find someone else. Find
Mm.
somebody else who has a better method. And I'm not going to say there's a right or wrong method. Some methods are good. Some methods are better. And if better's out there, then you've got to question if good is still good enough. So you always have to
Right.
find what works for you and don't give up
Mhm.
on it. I think one of the biggest errors that we make in this culture is that if we can hear a doctor say, there's nothing more we can do for you,
Mm.
that statement often gets confused with, and I think it gets heard and perceived as, there's nothing else that can be done for you. And they're
Right.
two different things. It's a very small difference, but it's a very powerful difference.
Mhm.
And even if someone says there's nothing else to be done, because I look on websites, I look on blogs, I look on, all over the place, and I read about what can't be done or what conditions can't be fixed. And I read them and I'm like, wait a second, we fixed that. That has been done.
Yeah.
So just because somebody's telling me that they can't do it does not mean that's a dead end. Turn
Right.
around, find a new route.
Yeah. Yeah. And that's the whole name of this podcast, Holistic Hope. Like, just
Absolutely.
remain hopeful and just keep searching, and you will find, prior to seeing Kyle, most weeks I'd see my chiropractor and then my acupuncturist. My acupuncturist moved office. I was without one for a while. I was just doing chiropractic, had a conversation with him one day. He referred me to an acupuncturist. That was Dr. Fang, who we had on the show last week. And now the two people I see every to most weeks is now Dr. Fang and you, Kyle, as my primary care practitioners. And my life has been thriving because of that. And that doesn't mean that you two are the only people that I see. From time to time, I need to go get blood tests. I need to get food sensitivities like checked up on. So I'm always your life, we're always evolving. You're never just healed. You're always healing. You're never just cured. We live in seasons, different things happen. And so don't give up. Don't take surgery as the first and only option. And even if you do surgery, people think that's, oh, just get the surgery done. Well, they don't also realize that there is a lot of physiotherapy, a lot of training and work that comes after surgery if it's, a muscular bone or something, whatever. So never give up hope. But Kyle, we're getting short on time.
Oh,
You are here in Tempe, Arizona,
yes,
which is just south of Phoenix. So if you are in this area in the Maricopa County, I would say definitely come and book a session with you.
absolutely.
You would be the first person I would recommend to people.
Thank you.
If people are not in this area and they're looking for somebody like you, what are they looking for?
I would say this, at least in Arizona, I know this. Any massage therapist is going to have the initials LMT after them. Okay, licensed massage therapist. It's kind of a broad title. You can
Mhm,
have people who are fresh out of school, just got licensed, or you can have people that have been around for 20, 25, 30 years doing this work. And even with that, you don't know what they've done, what they've taken. So, as far as training goes, as far as experience goes, it's a very, very broad statement. But I
mhm.
will say this, talk to a therapist, talk to people that see massage therapists. If somebody, there is nothing that makes me feel better as a massage therapy practitioner than to hear somebody go, man, I love my therapist. My therapist just rocks.
Mhm,
I love hearing that because that tells me
mhm.
that as an industry, we're doing something right. Now I will say this too, in this industry, if somebody says, no, I don't want anybody touching me. I had that happen once. No. That breaks my heart because that tells me that I'll never get a chance to help this person, and no massage therapist will ever get a chance to help this person. So we basically shot ourselves in the foot on that just because of one bad
Yeah,
experience. With that being said, it's a very small community. So it's a very tight knit community. We talk, we know each other. We know
mhm,
who does what kind of work. And chances are, if you're talking to a therapist, they may say, oh yeah, I know a guy on that side of town, or I know a lady on this side of town, that does this type of work.
mhm.
I can't tell you how many clients I refer to other therapists because they'll handle something different that I don't practice.
Yeah,
So, don't give up hope. Talk to other practitioners, talk to people that you know in the holistic health field. Talk to acupuncturists, talk to whoever you know on it. Chances are we can find somebody. And if they don't know, the next person you talk to may know. So
right. Yeah,
don't give up. Just keep going.
right. And you can talk to a therapist before you book an appointment with them
I
as well.
strongly
Like
recommend
people,
that.
communication. I didn't just trust my friend's referral on Kyle. And I had a long conversation with Kyle, and he broke things down for me and explained how he could really help me. And so having that conversation with you started to build that trust that allowed me to book that first appointment with you and then to walk out of there and go, wow, my thumb wasn't perfect after the first session, but it was a dramatic improvement. And so was my spine. And so I kept seeing you because I knew that if I continued working with you, you were going to continue to help me.
Absolutely. And I think that conversation is absolutely the most important part of your relationship with that therapist. When you have that
Mm,
conversation, you should be able to not only hear what's being said, okay, the technical side of it, you should know that therapist is passionate about what they do. They're convicted about what they do. If you don't have that, if you don't get that warm, fuzzy feeling, maybe we do need another therapist. Maybe something is missing on there. Any therapist you talk to, anybody who's doing any sort of work like this, they better be passionate. And really, when it comes down to something more exact, like neuromuscular work or structural body work, they better know their stuff. And they better be able to break this session down step by step, stroke for stroke, and tell you exactly what they expect out of it. Because we should be able to expect results. And we should kind of know where those results are going. And if we can't do that, then at that point, between the assessment, between the body work, between reassessment, we should already know kind of what the outcome is going to be. Without assessment, we're just guessing. We're basically just taking a shotgun approach, and maybe you'll get better, maybe you won't. What typically handles for assessment for me is I tell people all the time, when it comes to my body work, I want to be lazy. I don't want to waste my time doing 15 things, hoping that one of them sticks. I want to be able to assess. I want to find out what the issue is. I want to spend 5 minutes on that, reassess you, see if we're doing the right work, and then continue. And if I can spend 5 minutes and fix an issue, as opposed to spending an hour fixing an issue, I kind of know which direction I want to go in.
Yeah.
So, having that knowledge, having that experience, having that expertise is vital. You got to have it.
Absolutely. Kyle, I'm so grateful that we actually got to finally organize. We've been trying to get this done for a while now. So I'm so glad that we finally got this episode recorded.
Absolutely.
Now, for people to find you, like I mentioned, you are working out of Self-Centered Spa here in Tempe, Arizona, which the cross streets are McClintock and Warner. And for people to look you up, now Kyle spends his time practicing his craft. He is not spending time working on a website. So how do people find you? You're on Instagram.
Instagram, yes.
And I'm gonna put your screen name up, which is Kyle _Carper _LMT.
Yep.
You are on Facebook, and we'll pop all your links in the show notes as well.
Wonderful.
And then to phone or text you. So you can give Kyle a call. We'll put his number again in the description.
Absolutely. I recommend texting over the phone. Absolutely.
Texting, texting over phone. So, because Kyle can't answer his phone when he's in a session. So send him a text message, let him know that you heard about this podcast as well. So he knows how his client referrals are coming in. Send him a text message, and then he'll, contact you back and arrange to have that initial consultation, which you do a very thorough job on, I might add. Kyle, do you have any parting words for our audience today?
As I said, if you have an issue, talk to somebody about it. If they're not giving you the answer you want, find someone that does. Find someone that will give you that answer, and go with your gut. Go with what you feel when it comes down to that. If you have a good feeling about it, pursue it. If not, move on. But don't give up.
Absolutely.
Don't give up. Bottom line.
Don't give up hope.
Exactly.
Thank you so much for being here with us today, Kyle.
Thank you. It is a pleasure.
I appreciate you and all the work you do. Probably see you on Friday for my follow-up next session.
Yes.
And for all of our audience, stay well and go find a really good massage therapist. Have a great day. Thank you for joining us on the show today. If you like this episode, make sure to give it a thumbs up, subscribe to the channel, and hit the notification bell so you never miss an episode.